I'm going to talk to you about the importance of taking care of your mouth to protect your brain. Now, what does that mean? I mean, surely when we talk to you about brushing and flossing and looking after your teeth and gums, all we really care about are your teeth and gums. Well, no, because there's a thing called oral systemic health link. And that means what's happening in here can have effects and impacts on elsewhere in your body. And your brain is one of those places. And it's really unfortunate how many people fail to fully appreciate the importance of their oral health on their overall health and well-being. And I would say that even happens within my dental profession, and that's why holistic dentists like myself are increasingly more popular, because patients are wanting a different level of care. They want to join the dots to why they're having problems and be able to fix those up, and they want to be able to better manage their health and well-being going forwards. So the fact of the matter is, there's this delicate balance between the bacteria in your mouth, and that balance is important to your health as your gut microbiome. And a lot of people understand about their gut microbiome these days, and eating to have good gut health and taking probiotics and that sort of thing so that their gut's really healthy. But we're forgetting this part. Your oral microbiome is slightly different to what's in your gut, even though they are part of the same digestive tract. When certain bacteria in your mouth become overabundant, various problems start to develop, not just in your mouth. So we know if we eat too much sugar and we don't brush and floss and look after our mouth well, that the likelihood is we're going to end up with tooth decay or gum disease or both. We're going to end up with infections and problems, putting ourselves at risk to things like oral cancer as well, because those bacteria and viruses and fungi, they can cause problems. But not many people realise that other parts of your body can also be severely affected. Now, we're going to have one of these sessions. If you've listened to me before, we're talking about bacteria. There's going to be lots of Latin names, and I usually fail quite abysmally to get my mouth around these words. So let's see how we go today. So we're going to talk about periodontal disease, which is the advanced form of gum disease where you're getting infection and inflammation of the soft tissues and the bone that makes up your jaw and holds your teeth in your mouth. And this is initiated by P. gingivalis. Now, I backed out there because it's actually called Porphyromonas gingivalis, and I still don't think I said that right, so I'm going to go P. gingivalis on that one. And this is a bacteria that also impairs your innate immune response. It increases your risk for type 2 diabetes, heart disease, pneumonia, autoimmune conditions, and even mental health disorders. These bacteria have also been linked to types of cancer, particularly bowel cancer and pancreatic cancer. So when we say you need to brush and floss, it's not just your teeth we care about. So oral bacteria can fuel systemic inflammation. That means it goes from a localized infection and it tracks through your body and causes an infection of your whole system. It can also cause neurodegeneration. That's a problem with your brain and your nervous system. Now, when bacteria cause tooth decay and gum disease, when those ones that cause that enter your circulation and your circulatory system, your liver releases a product called C-reactive proteins, which have inflammatory effects on the rest of your body. Inflammation, in turn, is known to be a disease-causing force leading to most chronic illnesses, including neurodegenerative diseases such as Alzheimer's disease, Parkinson's, multiple sclerosis, and dementia. In a 2022 scientific review, this is what they said. It has been proposed that periodontal disease can initiate, which means it can start and cause and contribute to Alzheimer's disease pathogenesis through multiple pathways, including periodontal pathogens. Then you get dysbiosis, which means your bacteria are out of alignment, they're not in balance. Dysbiotic oral bacteria can release bacterial products into the bloodstream and eventually cross the blood-brain barrier. Now, that blood-brain barrier is supposed to be a barrier. It's supposed to stop foreign, toxic, nasty pathogens getting into your brain and your nervous system. So these bacteria can penetrate that barrier and get into your brain. Then once they're in there, the bacteria can also cause they cause problems. But sorry, jumping around a little bit because I'm so excited to talk to you about this. The bacteria can always also cause alterations to your gut microbiome, and that enhances inflammation and potentially affects brain function via what they call the gut-brain axis. The trigeminal nerve, which is a nerve in your face that supplies your upper and lower jaw, supplies sensation to your teeth and gums and tongue. It has been suggested that that nerve is another route for connecting oral bacterial products and the brain, so that they're tracking directly up the nerve pathways and into your brain cortex. Clinical evidence has suggested that patients with periodontitis, which is the name for periodontal disease, are at higher risk of Parkinson's disease and multiple sclerosis. Now, that's pretty scary, but it also means there's some element of prevention that can happen. So not only through your own oral hygiene and healthcare, but also through your dental visits and getting treatment for your periodontal disease and your gum disease problems. We need to take this very seriously. Only yesterday, I have a patient who's come in. She's in her mid-30s. She has a history of Hodgkin's lymphoma, which is a type of cancer. She's now free of that and in remission, but she's had chemotherapy and radiotherapy. She has not been the dentist regularly. Her last visit was about 4 years ago. This patient also smokes and has poor nutrition. All risk factors for poor health, but also poor oral hygiene and periodontal disease. So I do my due diligence, I do a full checkup, I do my pocket depth measures, which I've talked about in other podcasts and videos, so that I can ascertain what's going on with her gums, because they're all chronically inflamed, they're red, they're swollen, they bleed, there's loads of build-up under the gum line, and she's got bone loss of 5 to 6 millimeters around her tooth. Now, you might say, well, what does that mean, Rachel? 4 to 5 millimeters, 6 millimeters, what's the significance? Well, you've only got about 10 millimeters of bone around your tooth. So A, your teeth are loose, your gums are peeling away, you've got bacteria, food, debris, dead bacteria and dead skin cells and all sorts of nasties under that gum line. And that is causing chronic inflammation through the whole mouth. That amount of inflammation would cover a sheet of A4 paper. So you imagine that, sheet of A4 paper. I don't have one to hand. Yes, I do. Hang on. Excuse me. For those of you who aren't watching, I've just dropped a big book on my desk. But that is a sheet of A4 paper. I'm 5'3", 160 odd centimetres. That covers pretty much my whole torso. That is a serious amount of inflammation. Excuse me. But your dentist goes, oh yeah, your gums are just bleeding a little bit. No. That's not okay. Anyway, point of the story is, I explained to this young lady, you have stage 3 periodontal disease. Stage 4 is terminal, guys. So if we look at it like a cancer diagnosis, this means that we've already got spread. We've got spread of disease, not just through the teeth and gums, but round the rest of the body. So I explained to her she needs a medical procedure called quadrant therapy, deep scaling and root planing to be able to treat her condition. Now, this is a in-depth, involved, skilled procedure that takes several visits and about 4 or 5 hours of time in the dental chair. So I explains to her the cost, and she turns around to me and says, "Well, you're really expensive. I don't want to pay to have that done." And I'm like, okay. So we explain again about the disease, its impacts, and the impact on her health. What can you do? If people do not value having a long, healthy life, there's nothing I can do. Fortunately, most of my patients are here to see me because they're super motivated about being healthy and well. We did all the things. We offered, to spread the costs, help with the payment plan. I even, said, we can do it in less visits, see if we can reduce the fee, that sort of thing. But no, she just did not value her health, which when you consider that she's so young and she's already had serious problems, I don't fully understand. But anyway, I'm digressing. Let me get back to where we are. So where were we? We were saying that clinical evidence that patients with periodontitis are at risk of developing Alzheimer's disease, Parkinson's disease, and MS. And there's this link, this what they call a nexus, which I don't really understand what that word means, even though I've got a good education. I'm quite a simple person. Anyway, there's this link amongst the brain, the periodontal disease, and systemic inflammation. But this means that because we understand this, we can help support the body. Anyway, I'm reading now. I'm going to read what they said from the research. It might make more sense to you than me. I've only had a quick read this morning, just to pop it in here for you. So this nexus among the brain, periodontal, and systemic inflammation heralds new ways in which microglial cells, the main innate immune cells, and astrocytes, the crucial regulators of innate and adaptive immune responses in the brain, contribute to brain pathology. Basically, that says the link between your brain, infection in your mouth, and systemic inflammation opens pathways in which we can look at how the immune response cells in your brain contribute to brain pathology and what's triggering that disease within the brain. Currently, there is actually a lack of understanding about the cause, the pathogenesis of neurodegeneration, and that's hindering treatment development. So it does make me wonder if part of our treatment, as well as prevention, when somebody is early diagnosed with things like MS, Alzheimer's, Parkinson's, is actually dental care. Is actually to come and get deep cleaning, get infection in the mouth treated, maybe removing amalgam fillings and toxins and infections at the same time. Maybe this is the future, and we're actually going to get some collaboration between physicians, specialists, medics, and dentists again, rather than everybody being in these separate camps and doing their own thing, and me blathering on and everybody just ignoring it. Try getting an appointment to have a meeting with a GP clinic to talk to them about the importance of asking their patients about their dental health. Almost impossible. It should not be like that, guys. We should be working together. Anyway, we currently don't have the understanding. It's hindering development of treatment. But if we can prevent this pathogenesis by tackling one of the contributors, periodontitis, for systemic inflammation, through simple preventive oral hygiene measures, then this is definitely a good thing. It's a good thing from my opinion, and maybe from yours. You might go, wow, I didn't realize that looking after my mouth was so important. Well, here we go. Poor oral health damages your brain. Let's just say it straight out. Many studies have linked poor oral health to increased risks of dementia. Sorry, having a bad day with my words. It's really hot here in Brisbane, and I've been out gardening all morning, and I'm probably a little bit dehydrated, so I do apologise. You'll probably be listening to this though in Australian wintertime, but your summertime by the time this gets released. Back to what we were saying. I'm a bit bonkers today. Sorry, guys. that might have been a little bit inappropriate considering the subject matter. Okay, anyway, in 2019, a study discovered that P. gingivalis is actually present in the brains of patients with Alzheimer's. It is speculated that the bacteria responsible for periodontal disease may be a causative contributor to Alzheimer's. There are things called toxic proteases from the bacterium called gingipanes, which were also found. And the levels correlated with, okay, I am not a neuro person, so I'm just going to tell you what they said. And we might have to go look it up and do a bit of searching to get this interpreted. Maybe I should have done that a little bit more before I started talking to you about this. Anyway, my apologies, maybe next time. So the toxic proteases from the bacterium called gingipanes were also found, and levels correlated with tau and ubiquitin pathology. These gingipanes were also known to have neurotoxic effects in and of themselves, both in scientific lab studies and in real human beings. These gingipanes were they used a synthetic gingipanes inhibitor, and the researchers were actually able to reduce neuroinflammation by lowering the bacterial load of P. gingivalis. Now, isn't that cool? But we can reduce the bacterial load of P. gingivalis in the mouth before it gets to the rest of the body. And we can do that with good oral hygiene and dental treatment. It's so easy. We have direct access to this. I don't have to cut open your body and do anything horrid. Yeah, I know you don't like going to the dentist, a lot of you, and you think that what we do is horrid, but I come from a bit of a different perspective. And look, when we're doing deep cleaning, I always make your mouth nice and numb so you don't feel anything anyway. Anyway, back to this. Another study found that failing to brush twice a day increased the risk of dementia by as much as 65%. 65%. Wow. Failing to brush twice a day increased the risk of dementia. Say dementia, Rachel. As much as 65%. And then when people brush 3 times a day, their risk factor went down quite significantly. Most recently, there was an observational study involving about 40,000 middle-aged adults. Now, apparently, at nearly 55, I'm middle-aged, but I don't like to admit that, so I'm going to skip that very quickly. These adults had no history of stroke or dementia. They found that people with poor oral health had higher levels of neuroimaging markers associated with, just knocked the microphone. Let me just start that sentence again. They found that people with poor oral hygiene and poor oral health had higher levels of neuroimaging markers associated with white brain matter injury. Now that is significant because the neuroimaging markers evaluated in this study precede and are established risk factors of stroke and dementia. The results of that study suggest that oral health may be a promising target for early interventions focused on improving brain health. Now that was in the Journal of Neurology in January 23rd, 2024. Now I'm recording this on the 2nd of February. So this is a really exciting and recent study that I don't think is getting out there enough, and it should be the talk of the town when it comes to dementia and neurodegenerative diseases. Every dental practice should be screaming this from the rooftop, that we are playing or able to play a critical role at early intervention on improving brain health. because the neuroimaging markers show what's going on, the fact that these imaging changes are seen in asymptomatic, which means they've got no symptoms, no signs of memory degeneration or anything like that, it offers the hope that if the association is causal, which means if those bacteria are actually triggering the disease, then interventions to improve oral health can play huge dividends for subsequent brain health. That is blowing my mind, guys. That is incredible. I have been saying this, holistic dentistry has been saying this for at least 3 decades, that there is a link between oral health and your systemic health, that there is a link between gum disease and types of dementia and neurodegenerative problems. And now, finally, we actually have a study that says, oh my God, we agree. And actually, good oral health could prevent you from having brain problems. We have to take dental health and oral health far more seriously than we have been. And we have to overcome this notion that going to the dentist is an ordeal and is to be avoided. By the time you have got like that young lady who is really in a bad state, I mean, we don't normally see stage 3 periodontal disease until someone's a lot older. Don't wait until your teeth are loose, your gums are constantly bleeding, you've got infections and bad breath, and then you go to the dentist and they measure your pockets and they go, it's too late, you've lost so much bone, you're going to lose your teeth. Now that's a travesty in and of itself, but just think of all the damage that has been done day after day, week after week, month after month, year after year, that you have had this chronic inflammatory disease in your mouth that hasn't been treated or isn't being treated appropriately, that has now already triggered C-reactive protein, changes in your brain, inflammatory damage that's going to lead to stroke, heart disease, diabetes, Alzheimer's, MS, Parkinson's, dementia. That could have been prevented. Could have been prevented. So we need to change the way we look at oral health. We need to understand how important it is to help prevent you from having all these other problems. This is why I do what I do, guys. This I am passionate about. I do not sit there and clean people's teeth. I hate that. I hate that expression. We're not cleaning your teeth. We are treating disease. We're helping you have a healthy life. We're helping to prevent serious health issues as well as tooth loss. We need to get this message out there. Please talk to other people about this. If you're listening to this podcast and you haven't switched off after 2 minutes because you're bored with me yabbering on, please get the message out there. Like, subscribe, comment, get the algorithm putting our videos and podcasts higher up, but talk to people about it. And dentists, if you're listening to this, talk to your patients, tell them what's going on in their mouth, tell them about the links between dental disease and systemic problems. Okay, rant done. I'm going to talk to you about how you can optimize your oral health. Well, number 1 is your diet. You thought I was going to say brushing and flossing, didn't you? Well, there you go. No, it's your diet. Sorry if there's a little bit of background noise. Excuse me. Caries, which is the professional term for tooth decay, and periodontal disease, which are the end stage of gum disease, where you've got soft tissue and bone damage. They are both primarily caused by a poor diet, combined with poor oral care. So when you add these things together, you're going to have problems. Both these factors need to be addressed. So yes, you do need to brush and floss. I wasn't letting you off the hook that easily. So to optimize your diet for oral health and mitochondrial function, which means you're going to have lots of energy and be nice and healthy, you want to radically reduce your intake of refined sugars and processed foods, as they fuel the growth of the disease-causing bacteria in your mouth. Instead, you're going to focus on eating real food, the way nature grew it, the way nature intended it, and whole, unprocessed food. So meat, veggies, fish, fruit, nuts, seeds, things that nature produces. You're going to need to also optimize your vitamin D, your K2, magnesium and calcium levels. Now, these nutrients all work together to help protect your gums, your teeth and your bones. Calcium strengthens your bone, but it only works if it's able to get from ingestion, digestion, and out to where your body needs it. It needs to get to the right places, and this is where vitamin K2 is crucial. It directs the calcium into the bone. It's like the sat nav, your GPS for calcium, going, you need to turn left, off you go. It helps get the calcium into the bone, and it prevents it from being deposited along your blood vessel walls. You do not want your calcium calcifying your arteries, because then they get hard and they get stiff, and then you get plaque buildup, you get cholesterol, you get atherosclerosis, and you end up with heart attacks and strokes. You need your calcium to get from A to B. So you need your vitamin K2. Now, you can get that from certain foods, but I just find it easier to take a supplement. So have a look. Vitamin D. Vitamin D deficiency increases your risk of inflammatory disease across the board. It is associated with a higher risk of all disease. Catching the flu, COVID, colds, everything. Your vitamin D3 should ideally be above 60 ng per mil for proper bone formation. If you can't keep your serum levels of vitamin D at or above that level using sensible sun exposure, and that means not getting burnt. So you go out in the sun, if you find after 10 minutes you get burnt, you're only going to go out for 8 minutes so you don't get burnt, and you do that regularly. That is sensible sun exposure. You need sunshine to create vitamin D. If you live in an area where you're not getting a lot of sun, you can't go out very often, you burn too easily, etc., then take an oral vitamin D3 supplement. You also need to increase your intake of vitamin C and or CoQ10, particularly if you struggle with bleeding gums. This is a common sign of scurvy. Bleeding gums means you have scurvy. Yes, in this day and age. You thought scurvy was sailors in the 1600s or whatever was the time they were off on ships and boats, and probably a bit later than that as well. Anyway, if your gums bleed, you've got a vitamin C deficiency, or you're not getting enough CoQ10, or both. So supplement and see what happens with your gums. So I'm going to talk about, got my list. I have been a bit rabbity and rambly today, but I'm very, very excited about the research, and I really want to get the message out. So I'm probably going to just do like some shorter ones of this, but this is the long one today. So toothbrushing do's and don'ts. When it comes to your oral health, you got a toothbrush, and it's got to be regular. Now, by regular, I don't mean that you regularly brush your teeth once a day, or you regularly brush them every other day, or once a week. No, regularly. So you brush them when you wake up on a morning, and you brush them before you go to bed at night, minimum. Okay, I would also then like you to brush your teeth after you eat. Otherwise, you've got bits of food stuck around your teeth and mouth and gums, and the bacteria are just having a party. Okay, so research shows, and I don't know why, but 2 minutes is the ideal brushing time. The ideal pressure, now I'm not expecting you to weigh this, is 150 grams. which is about the weight of an orange. So that's about, you pick up an orange and kind of feel how heavy it is. That's kind of the pressure that you need to be using with your toothbrush. Brushing your teeth too hard or longer than necessary is not recommended, because that's going to do more harm than good. So please don't go crazy thinking I can make up for it and I can brush 10 minutes every day and 10 minutes at a time and scrub really hard. No, you're going to damage your gums and you're going to damage your teeth. 2 minutes, light pressure, gentle, thorough. I've got podcasts on this, so go back and check those out. There's also blogs over at evolvedental.com.au, and there's probably some other videos as well. Ideally, brush 2 or 3 times a day, in the morning, in the evening, and then wait about 30 minutes to an hour after your meal to brush your teeth. The reason is if you brush immediately, it's not recommended, because the foods and the bacteria can create acid, and that weakens your enamel, and then you scrub away the slightly demineralized enamel and you're going to make your enamel thinner. So just wait for your saliva to reharden and remineralize the enamel, so about 30 minutes to an hour, and then you can brush your teeth after your main meal. Now, you think you want to brush straight away, but it's actually counterintuitive. There were studies done about 20 years ago now, which found that brushing your teeth too soon after eating or drinking, especially acidic foods such as soda, that accelerates erosion and wear of your teeth, and then your teeth become sensitive and they become prone to tooth decay. Don't want that. Okay, for toothpaste, I'm holistic, so I'm going to recommend non-fluoridated versions that contain, if you can, hydroxyapatite. Hydroxyapatite is the building block of your dental enamel, so that helps to replenish and reharden your tooth enamel naturally. And studies at the end of 2023 came out and said that actually these hydroxyapatite toothpastes work better than fluoride ones. So thank you very much for that one. Can't remember the source, but I do remember the study, and I went, see, told you so. Anyway, you also want to check that your toothpaste doesn't have lots of harmful ingredients. You certainly don't want triclosan, which is a soap banned in the US, I believe. Sodium lauryl sulfate, propylene glycol, diethanolamine, parabens, and microbeads. Because all those things are not good for you. Look, you can make your own toothpaste if you like, and I'm going to go through that with you very shortly if you hang on. It's simple and it's inexpensive. If you wanted, you could mix some coconut oil with some baking soda and a little pinch of Himalayan salt. Just be careful with the baking soda and the salt. It can be a bit abrasive, so you don't want to be scrubbing too much, because you're going to wear your enamel away, and we don't want that, do we? You can use peppermint oil to add some flavor. It's also antibacterial and is supposed to help prevent cavities. Start with a couple of teaspoons of coconut oil and baking soda, and then add more of your ingredients until you get a consistency that you like, really. Slightly firmer seems to be a little bit easier to use. And then I did a little bit of an internet search and I stole this recipe. I think it was from either Mamma Mia or might have been Mind Body Green. But anyway, I like bentonite clay, and we use that in my clinic. We use that as a polish. We put other little bits and pieces in it to help remineralize and protect your teeth. But this is a really good one that you could use at home if you wanted. So it's half a cup of bentonite clay, about 1/8 of a teaspoon of salt, so not much, 2 teaspoons of baking soda, then you're going to get about 1/2 to 2/3 of a cup of water, 1/4 of a cup of coconut oil. You can add a teaspoon of stevia, that's optional if you want a little bit more sort of sweetness, not really needed in my opinion. And then you can add 1 to 4 drops of peppermint essential oil. So you're just going to mix the clay and the salt in the bowl, add the water, mix them all up, pop all the rest of the other ingredients in, and you've got a paste. You store that in a jar with a lid, And then every time you go to use it, you just spoon a little bit out onto your toothbrush. You can dampen it just by running it under some gently running water, and away you go. Brush as normal. I was going to say you can run it under the tap, but if you're American, you don't say tap, do you? You say faucet. And I won't do an American accent because I'm English with part Australian, so no, we won't go there. Anyway, I'm feeling pretty cheeky today. I told you I am excited about this research. It only came out last week, and I'm like, yes. Anyway, let's carry on. The importance of flossing. Whilst most people brush their teeth every day, most people don't floss. It's very overlooked, and that's unfortunate because flossing is probably more important than brushing when it comes to your gum health. Now, if you don't like flossing, check out, I wish I had it, I'm going to get some so I can show you. You can get this silicone floss. It's basically got two little rings of silicone and a piece in between, and you floss up and down, and it's really easy to use. And then you just wash it and you reuse it. I know it sounds a bit yucky, but you reuse your toothbrush anyway. That you may find more useful and easier to do. But also, if you really can't floss and you detest it and you can't get it in between your teeth, you can use interdental brushes. There's brands called TP and Pixters, come in lots of different sizes, and you can work out which ones fit your gaps the best, and then you can clean in between your teeth and massage the gums and get rid of the plaque as well. So cleaning in between your teeth, flossing removes bacterial precursors that form plaque, which is the yellowy stuff that builds up on your teeth, and that eventually, because it's not cleaned away, forms hard tartar that cannot be removed by regular brushing and flossing, and you need to see the dentist to get this removed. Tartar is what eventually causes the damage that leads to decay and tooth loss. I recommend using a good dental floss. You can get vegan ones that are covered in non-toxic chemicals, and to ensure you floss properly, I have got a blog on this on evolvedental.com.au. You're going to use a piece of floss that is about 15 to 18 inches long. That's going to be 30 to 50 centimeters, maybe a little bit more, but that ballpark. And you're going to wrap the ends around each finger, so wrap around your index finger, and then you hold it kind of between your finger and your thumb. I won't show you, it's pretty disgusting watching somebody floss. I hate those videos, so I'm not going to do it, but you kind of get the gist. You can use tape, you can use slightly thicker flosses, and you gently slide the floss up in between the teeth all the way to the gum line. Don't snap it, not bing, bing, bing. We are not using cheese wire. We're just sliding it up gently. You don't want to snap, 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 because you're going to damage your gums. At the gum line, you wrap the floss around the tooth, a bit like towel drying your back. So you make this C shape around the tooth, and then you gently but firmly slide the floss up and down the tooth, side to side, making sure you get down into the gum line, like cleaning under your fingernail as well. Make sure you do both sides of the gap. So you do one tooth and then over to the adjacent tooth before moving on to the next step. You're going to repeat that on the rest of your teeth, including the very back edge of your last tooth. Nobody cleans there. No, they don't. And it always has a big lump of tartar and inflammation because nobody cleans over the back edge of the last tooth. So that is an important takeaway. So if your dexterity is an issue, if you just don't like using floss, then you can use the little TP interdental brushes or Pixters. It's all the same thing, just different names. They allow you to clean in between your teeth with one hand. And if brushing, flossing, or using these interdental brush to remove plaque causes your gum to bleed, that is not because you're being too rough or, I hurt myself with the floss. No. It is a warning sign that bacteria are at work and they are causing damage. Bleeding is a sign of gum disease, and if that is left to fester, it can easily cause chronic inflammation elsewhere in your body. The answer is to gently floss and brush more often. until your gums no longer bleed from brushing or flossing. And if you can't get the bleeding to change, if it persists longer than a week, you need to see a dentist. Yes. Okay. An alternative to floss is a water pick or an oral irrigator. Here you've got the option of squirting and jet washing the water in between your teeth and around the gum line. If you get one that's got a little water reservoir on there, you can add a couple of tablespoons of 3% hydrogen peroxide into that water tank, and that is a great treatment for gum disease. A treatment that has been around since about 1913. So over 100 years we've known that hydrogen peroxide works really well to treat gum disease. And it is still a treatment for gingivitis, which is inflammation of the gum, and periodontitis, which is the gum and the bone. Rinsing or irrigating your mouth with diluted hydrogen peroxide is an effective way to kill the harmful bacteria associated with the gum disease conditions. Just be sure to dilute it with some plain water and don't swallow it. Make sure you spit it out. We use hydrogen peroxide as a pre-rinse for all our patients when they come into our clinic to reduce the amount of bacteria before we look in their mouth and do any procedures. And we also use it as part of our irrigation solution that we wash and flush down into deep pockets with when we're doing treatments for gum disease. So how can you care for your teeth and gums beyond brushing and flossing? Well, we've talked about diet. There's also ozonated oil. It's not something I have in my clinic. I don't have an ozone machine. Ozone gas has actually been used to treat dental decay and gum disease, but it must be done by a holistic dentist because inhaling the gas can be dangerous. And that's one of the reasons I don't have it in my clinic. I just don't want to have too many hazards that can potentially be a problem for me and my staff. For home use, you can get ozonated oil on Amazon. Apparently, it's a good alternative. Apparently, it's safe and easy to use, and you can just rub it into the gum line with your finger or a cotton bud, Q-tip, I think you call them, or a toothpick. Smear some on your floss or on your interdental brush and get the ozone down in between the teeth. Something I need to do a bit more reading and research on. I only came across that recently, so maybe I can come back with more information on that in one of my later episodes. Methylene blue. One of my patients uses this, and I said, why is your tongue blue and your fillings blue? And she's been overdoing it. Okay, you can use that as a mouthwash. You only want a 0.5% or 1% concentration. And that deactivates harmful microorganisms in the mouth that can lead to periodontal disease. Xylitol. This is a natural sugar alcohol, and it's been shown to reduce and even reverse dental decay by inhibiting the proliferation of mutans streptococci or Streptococcus mutans in the plaque and saliva, and it actually stops the adhesion. It stops the microorganisms actually sticking to the surface of your teeth. You can easily find xylitol in toothpaste, mouthwashes, oral tablets, chewing gums, even types of mints and lozenges. You can just make sure, again here guys, that you buy products that don't contain fluoride or triclosan because they are both toxic. Also keep xylitol products away from pets. Xylitol is exceedingly toxic to dogs in particular. You can do oil pulling. Oil pulling is a gentle way to reduce plaque, gingivitis, and bad breath. Some people say that it also may improve several systemic diseases, including inflammation. I'm not so sure about that. Ideally, they say you should be doing it for 15 to 20 minutes a day, but you need to work your way up slowly. It may take a while before you get used to kind of, you've got to really do it. You know, you can't just have it in your mouth. You've really got to force it backwards and forwards. So you've got to get used to working the muscles in your cheeks for that long. When you're done, you spit the oil into the bin, into your trash or the toilet. I don't do that because we're on a septic tank, and I don't think you should do it anyway, because it can clog up the sink, cause problems with the plumbing. Then rinse your mouth with water once you've done, and then brush your teeth as usual. Usually we recommend coconut oil. You can use MCT, which is the medium chain triglyceride version of the coconut oil. That may be an even better alternative. They've both got antiseptic and antimicrobial and anti-inflammatory properties, but MCT oil's got more fatty acids than your coconut oil, which makes it even more effective at trapping the harmful bacteria and disrupting the biofilm, which is the build-up of bacteria all coming together and holding hands and forming this kind of colony on your teeth. MCT is also liquid. It makes it easier to swish around your mouth, and it actually feels better in your mouth too. A lot of MCT oils actually have no flavour, which I prefer. I don't like that strong coconut oil taste in my mouth. You can use peppermint oil, peppermint essential oil, peppermint oil extract. It's been shown to be very effective at preventing the development of biofilm that may lead to cavities and bad breath, and it's more effective than your mouthwash chemical chlorhexidine, which is what's in most dental mouthwashes, and chlorhexidine, when you use it for too long, actually makes your teeth stain. You can use where was I? So you can use a mixture of half a cup of distilled water, a couple of teaspoons of baking soda, some sea salt, peppermint essential oil. You can put some clove oil in there as well, some tea tree, xylitol, and you can add a little bit of hydrogen peroxide, and you just mix up those ingredients in a little bottle, shake well, and then what you do is you swish that around your mouth for a couple of minutes, spit it out, don't swallow. Works really well. Really good way of reducing tartar buildup as well as alkalizing your mouth. This is a long podcast today, guys. I hope you're still with me. Anyway, I will carry on. A few more things I want to say to you. You can use tissue salts like silica, calcium fluoride. That's a natural one. Calcium phosphate, calcium carbonate. I use mineral salts with lots of calcium, magnesium, just to swish around my mouth, and then I swallow that to get my minerals into my body. That can help boost your oral health. And don't confuse calcium fluoride with the chemical formulation of sodium fluoride that is found in toothpaste. Sodium fluoride is toxic and carries a poison warning. Calcium fluoride is natural and does not carry a poison warning. And the other thing that I would encourage, you breathe through your nose. Now, whilst that may seem a bit off topic, why is she talking about breathing? How you breathe actually has a big impact on your oral health, guys. Chronic mouth breathing dries out your mouth. It encourages microbial growth that leads to tooth decay and gum disease. So you need to learn to breathe through your nose. I have talked about this. I've done a podcast, I am sure, on mouth breathing, and if not, there's one coming soon. I will go through my list and check. But yeah, if you breathe through your mouth, it dries everything out, changes the oral microbiome, and then you're in for problems. So, in summary, if you want to have good brain health, if you don't want to end up with neurodegenerative disease, if you don't want to end up with heart disease, strokes, diabetes, cancers, you don't want to lose your teeth, then you've got to make your oral health a priority. So if you've been a bit slack, if you haven't been brushing and flossing as much as you should do, if you haven't been your dentist for a while, or your gums bleed and you just think, oh well, that's just normal, happens all the time. No, it's not normal. It's common, but it's not normal. It's a sign of disease and infection. If you've got these things, and you've got to take charge. If you want to be healthy, you've got to have a healthy mouth for a healthy life. Hello, it's the strapline of my dental practice. You've really got to make the effort to address the issues and the health of your mouth. It's a relatively simple prevention strategy that can pay really big dividends, preventing serious and costly health problems. So brush, floss, good diet, mouthwashes, dental visits. Get on the program, guys. Get in the dental zone and have a healthy mouth for a healthy life. Thank you so much for joining me. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. If you live in the Brisbane area or you're willing to travel and you'd like a holistic dentist, then you can give us a call 0737 20 1811, or you can check out evolvedental.com.au. We do have an online booking there, guys, or just use that for more resources. Thank you so much for joining me. Please like, please comment, subscribe, share, tell people about this. Talk to them about what you've learned about. Oh, did you know if your gums bleed, you could end up with dementia? Yeah, let them know. And thank you once again. I'm Dr. Rachel Hall. Until next time, stay in the zone.